I'm Brooke McAtee, and I am a Women's Health Ambassador for the St. Francis Gala. I'm currently the director of the nursing programs at Northwest Missouri State University. I actually began my nursing career in maternal child in labor and delivery at University Hospital. So right out of nursing school, I was fortunate enough to work in a labor and delivery unit that actually handled a lot of level 1 trauma patients. And I had to deal with a lot of variety of OB patients during their labor and deliveries that I had to care for with extreme measures, but also had the advantage to see labor and delivery at its norm, but also interventions and things like that that really heightened maternal health in the state of Missouri, and especially at University Hospital. So I got to be part of a lot of different things, technological advances as well as obstetric advances throughout my time there. And I loved it so much that I actually went into education. So when my family moved back to my hometown of Trenton, Missouri, I started educating and doing childbirth education through a clinic that I worked at, teaching others in our community about childbirth, delivery, and how labor would be during that time. So I really enjoyed that, found myself really interested in education and loving specifically maternal child education. So I was then invited to apply for a position at North Central Missouri College because they had an OB position available in their teaching area. And so I applied for that, and I was fortunate enough to get that position. With that position, I taught new and upcoming nurses fresh in the field about labor and delivery, obstetrics, gynecology, and then of course into neonatal and pediatrics as well. So I learned a variety along with them, but I also was able to keep my hand in the clinic side. And so I was able to utilize rural healthcare at Trenton and Wright Memorial, as well as Hedrick at that time, utilizing their obstetrics units for clinical for my students. And so I was able to be their clinical instructor during that time. And into a couple years into that, I was able to transition to Mosaic in St. Joe and take my students, the associate degree students, to the obstetrics unit there. And again, got a little bit higher level care at St. Joe because again, we were used to the rural healthcare setting, dealing with a little bit more traumatic or more I guess I should say complications that were occurring that could occur at St. Joseph that Mosaic was able to handle. But again, my heart was truly in that rural healthcare and education, a lot of education for those people because they just didn't have a lot of access to those entities. So I loved doing that. I loved teaching students how to be that labor and delivery or neonatal nurse to those clients because again, they deserved the education and time put forth with them. With that, I really saw, unfortunately, during that time, the transition of women's health. And so I started to see the rural healthcare setting kind of close in on women's health as that high risk. It is a high risk area. However, it's one of those things that a lot of hospitals think, oh, well, it's costing us some money, so we need to get rid of it. And we don't really think about maybe the ramifications of taking away women's health from rural healthcare entities. And so what happened was my hometown hospital in Trenton decided to close the doors on the obstetrics unit just a few years after I started teaching. It was devastating for a lot of different reasons. One, because I was obviously a patient there. I had birthed my own child there, utilizing their services, but also as a nurse and as a person who was putting out more nurses into the field who were interested in maternal health, who really had the passion to care for those clients, they were now having to drive 30 minutes to an hour and a half to care for those patients. But also our patients who were in our community were now having to travel to seek care for themselves and their unborn babies. So with that, we had transitioned to Hedrick Medical Center in Chillicothe. And so that's where I continued a lot of my clinicals, was able to, again, continue that rural healthcare setting. And again, make sure that the students were seeing the ramifications of rural health compared to, again, a little bit higher level health in St. Joseph for a little bit higher level obstetrics unit. So it was a great comparison because they were able to see that and the advantages of both settings. Unfortunately, as we all know, Hedrick Medical Center has also now closed their doors to obstetrics. And so really, when I think back, I am currently a person who lives in Maryville, call Maryville my home. However, when I go back home, to my hometown, it's Trenton, Chillicothe area. And so unfortunately, people that I've grown up with, people that I know who are pregnant, trying to seek out maternal child specialists, things like that, they're having to travel now to get the care that they once were able to get maybe in that area, or at least within 30 miles of that area. So now they're having to travel extensive time frames to make sure that their baby and themselves are cared for during that time. So it's been really disheartening to hear that we continue to struggle with that in our rural communities, and that there's advantages now to continuing to grow our maternal health areas within those specialty areas within our rural health communities. And so I foresee it being something that, as far as Mosaic Maryville really can grow and advance in this area. So we all, as healthcare professionals, we all know that there is a desert surrounding a lot of rural health communities, which means that we have to seek access in other places. The unfortunate part of that is we all also know about the social determinants of health, and that transportation is a big factor of that we have to ensure that there are ways to get that care to them. And unfortunately, a lot of people, and I'm speaking about general communities, a lot of people, when they can't seek healthcare in their immediate area, meaning within 10 to 20 miles of their home, they're much more likely not to seek care at all. So instead of traveling maybe another 30 minutes, they're likely to put that off. And so unfortunately, what that causes is worsened health conditions, because we've now taken away the care that they could have gotten very quickly and gotten on top of that ailment. Unfortunately, they've waited a little too long because that care was not provided just very quickly at home. Instead, when you put in travel into that, or again, the financial aspect of that. So travel takes finances, and how do I get there, and how do I pay for this, and how is it all going to work into this healthcare spectrum? When you start to think about all of those ailments, it really impacts, if I can't do that, it's probably nothing. And so they start to kind of put it off. And unfortunately, that results in really concerning ailments later on, because they haven't sought care when they started to have symptoms, or that primary care person wasn't the person that pointed them in the right direction at that point. So that's where we can turn things around and ensure that that is offered closer to home. I'm passionate about maternal health. I've been in it since truly since I was out of college as a nurse. It was my immediate profession because I knew it was my passion. And I've taught it since then. So there's always been a part of me that has touched maternal child health. And I know the benefit of having a maternal child health unit within your community, and how that grows the knowledge and understanding of that area, and really educates your community on not just during that obstetric side where they're pregnant, but even after pregnancy, how to allow them to care for their children, and getting into that pediatric realm. So, and them as women's health in general, taking care of ourselves. We all know that women are not great about overseeing themselves and caring for themselves, and that's really the background and the backbone of women's health. We not only take you through that time of your life where you're delivering and you're having babies, but also to care for you when you're dealing with cancer, breast cancer, endometrial cancer, all kinds of different ailments that face women's health. And so that's why I feel very passionate about St. Francis. This specific entity and this specific being an ambassador for this is a priority for me, because I feel like it's so important that we continue to support this initiative.